Have you been wondering which Medigap plan is better, Plan F or Plan G? Hi there, if we haven't met yet, I'm Danielle Roberts, Forbes Finance Council member and co-founder here at Boomer Benefits, where we help baby boomers navigate Medicare. In this video, I'll show you the two most popular Medigap plans and discuss why some people feel like Plan G is a better value than Plan F. Stay with me to the end of the video, and I'll also tell you how to sign up for our free New to Medicare webinar, where we go over everything you need to know when you're new to Medicare. Let me start by saying that Medicare supplements and Medigap plans are exactly the same thing, just two different phrases used to describe the same product. There are 10 standardized Medigap plans offered in most states, and for decades, Medicare Plan F has been the top seller. This is because it offers the most coverage. When you look at standardized plans side by side, you can see that Plan F fills in all of the gaps in Medicare, whereas other plans leave a portion for you to pay. For example, if you look at Medigap Plan L, it only covers 75% of your hospital deductible and skilled nursing and leaves you several other things to pay. Medigap Plans A and B cover even less, which is why so few people ever want to buy these plans. Many people living on fixed incomes want peace of mind when it comes to the health coverage, and Medigap Plan F really delivers this because it provides what we call first dollar coverage. First dollar coverage means that it covers all of your portion of Medicare claims expenses starting from the first dollar. It completely pays for your Part A and B deductibles, your skilled nursing coinsurance, and your regular copays and coinsurance. How this plays out for you in real life is that you'll never pull out your wallet for any Medicare covered services. There's no copays at the doctor or for lab work, no deductible to pay when you go in the hospital or if you need expensive diagnostic testing. Whenever Medicare pays its share on a claim, Plan F kicks in to pay your share. Being that Plan F offers the most coverage, it is usually also the most expensive Medigap plan among those that you could choose from in your area. Now, let's compare that to Plan G. As you can see, Plan G offers the second most comprehensive coverage. The only difference is that Plan G does not cover your Part B deductible. So when you enroll in Plan G, you'll have this one small deductible to pay out of your own pocket upon your first outpatient service of each year. Once you've satisfied that, it functions exactly like a Plan F for the rest of the year, covering all of the rest of the costs that would otherwise have been yours to share. Because you're taking on the Part B deductible yourself, Plan G offers lower premiums than Plan F. Let's look at an example for a female non-tobacco user turning 65 in zip code 76108. Running the numbers today, we find that the lowest Medigap Plan F in her zip code has a premium of $133.60. When we search for Plan G, the lowest rate is $101.08. This is a savings of $32 a month or over $390 per year. Now, if she signs up for Plan G, we know she'll pay the Part B deductible if she uses any outpatient services that year, but then she pays nothing else. So her annual savings after we factor in that she will pay that deductible is over $200. Considering that all the other great benefits of Medigap plans are the same, no networks, freedom to choose your own provider, nationwide access, no referrals necessary, and no copays, enrolling in Plan G is a winner. Now, these rates vary widely across the U.S., and some areas have substantially higher rates than others. In some areas, we may not see as much savings between the Plan F and G that are offered. However, even if enrolling in Plan G saved you only $100 a year, my philosophy is that every dollar that stays in your pocket versus an insurance company's pocket is a pretty good dollar. I want to talk for a minute about rate increases. All Medigap plans have rate increases nearly every year, including Plans F and G. This happens because the cost of healthcare in America is skyrocketing, and your supplement plan is paying around 20% of all your healthcare costs. When the cost for healthcare services increases, the price of insurance increases along with it. You're likely to hear that over the last decade, Plan F has had higher rate increases than Plan G. This was particularly true a few years ago, but in the last 18 months or so, we've seen the rate increases level out, with the percentage of increase on Plan F versus Plan G being more in line with each other. However, there are some changes coming to Medigap in 2020 that might make the rate for Plan F escalate faster than Plan G. Beginning in 2020, new Medicare enrollees will no longer be able to purchase Plan F due to legislation that was passed eliminating plans with first dollar coverage. People who are eligible for Medicare prior to 2020 will still be able to buy Plan F down the road, but new Medicare enrollees whose effective dates are on or after January 1st of 2020 will not be able to get Plan C or F. Since new enrollees will no longer be able to join these plans, we'll have a group of people on Medigap Plan F that are aging with no newer, younger, and potentially healthier people joining that pool that lowers the claims ratios. So over time, this could mean that Plan F rates may escalate faster than other plans, but we won't really know for sure until we get there. Medigap Plan G is not going away after 2020. It will continue to have a new stream of younger 65-year-old enrollees every year that help to keep that pool of risk more level. So this is one of the reasons why I think we see so many people opting for Plan G today. So is Medigap Plan G better than Plan F? Technically, Plan F has the most comprehensive coverage. However, when all things are considered, Plan G can often be a better value. It is currently the most popular seller here at our agency. I'd love to hear what you think after watching this video today. Are you leaning toward Plan F or Plan G? Or do you like another plan like maybe Plan N? Comment below to let me know. And if you are still learning about all things Medicare and would just love for someone to show it to you in a low hassle environment with no sales pitches, I would like to invite you to join me for the next Boomer Benefits New to Medicare webinar. You can register for this free webinar on our website, and I'll include that link in the notes for you below. Don't forget to also subscribe to our channel so that you can always be notified when we post the latest and greatest Medicare videos. Thanks for watching, and we'll see you in the next video.